Today's presentation is going to be on topical steroids, and though this doesn't sound as exciting as learning to put a chest tube in someone or performing a surgical crike, you're going to use this knowledge much more often than trauma over the course of your careers. This is an easy, high-yield topic, so buckle in. What are topical steroids? It's a steroid that comes in the form of a gel, cream, lotion, etc. Many of us are familiar with prednisone or Medrol dose packs that we give people for allergic reactions that occur over the entire body, or a large part of it, or for wheezing in someone with pneumonia or asthma. But what if the area we're talking about is much smaller, like the size of your palm? You could give oral steroids, but it may lead to more serious side effects. It would be like using a .45 caliber pistol to kill roaches in your home. Yes, this will lead to dead roaches, but also a dead TV set, dead microwave, and potentially a dead neighbor. So let's use something that is equally effective and less likely to cause collateral damage, or in this case, side effects. When we use topical steroids, we can give much higher doses of a medicine without risking serious side effects, leading to better treatment outcomes. Steroids, whether topical or oral, work by stopping or reducing inflammation and cell division. For a combat medic, we are talking more about reducing inflammation, itching, etc., likely due to contact dermatitis. It is very unlikely you will have to manage something like psoriasis, so I'm going to skip over it, but topical steroids are very useful and you should understand how to use them. Steroids are an interesting medication because there are many things that will affect how potent they are, and therefore how effective. To begin with, steroids are divided into 7 different classes, where class 7 is the weakest and class 1 is the strongest. Roughly, as you move up in class, the steroid will increase in potency by about 10 times. So class 6 is 10 times stronger than class 7, and class 5 is 100 times stronger than class 7. Additionally, the way the steroid is packaged affects strength too, where ointments are stronger than creams and much stronger than lotions. This is because ointments, given that they are oily, seal the medicine in the skin better, thus allowing the medicine to penetrate deeper. Therefore, if you had 2 tubes of steroids, for example, triamcinolone 0.1% ointment versus triamcinolone 0.1% cream, though the listed concentration is the same, the ointment is stronger. Another tip on the subject is that the ointments are the drug in its purest form, and as you try to package it in other ways, like as a cream, you must add other chemicals, which the person might have an allergic reaction against. So, to keep it simple, always use the ointment. Where you put topical steroids also plays a role in how potent they are. Places where the skin is thinner, like the genitals, face, eyelids, etc., are going to absorb a lot more of the medicine than an area of your body that has thicker skin, like your palms and soles. So a class 6 applied to the genitals functions as if it were a higher class. Additionally, the surface of a lesion will also dictate absorption, like dry fissured skin absorbs more readily than intact skin in the same area. Here's a breakdown of common topical steroids unique to each class. You will never use class 1 or 2, and in fact, only dermatologists will typically prescribe these. Now, starting with class 3, we have a steroid that is probably the most common one you will run across, being triamcinolone. And you will note that the same steroid, with just a slight change in its concentration, can make huge jumps in its potency. If I had to select one of these for you to carry in your aid bag to treat all of the areas of the body, it would be the class 4, triamcinolone 0.1% ointment. One disclaimer, if you use this for the face and genitals, treat for 7 days, rather than 14 days, or use hydrocortisone 2.5%, because remember, the skin is thinner in these areas, so even though the hydrocortisone being the class 7, the weakest, is going to work as if we're much stronger. So you can only imagine using a class 4 in those areas is going to function as if we're much higher, much stronger. I wanted to point this out because as with any med, the bigger the dose, the more likely or severe, or both, the side effects. Thus, the stronger the topical steroid, the easier it is for it to cause skin atrophy. That's why you don't routinely use clobetasol, which is a class 1 steroid and thus 100,000 times stronger than hydrocortisone, to routinely treat hemorrhoids or facial dermatitis. When using triamcinolone, treat for no longer than 14 days. If it hasn't cleared up by day 14, then contact your provider for additional guidance. If you are sure you see significant improvement nearing the end of those 14 days, however, you can extend it for an additional week. How can I make my steroid function as if it were a higher class? Use an occlusive dressing after applying the ointment. This could be something as simple as having the soldier with contact dermatitis of their hands put on latex gloves after applying the steroid ointment before bedtime, or wrapping a certain part of their leg with cellophane. This technique will lead to increases in absorption by anywhere from 10 to 100 times. In my experience, I can count on one hand the times I have had to use this technique. More commonly, I have used this in combination with Vaseline or another moisturizer and not a steroid to help people with severely dry skin. Effective moisturizing can sometimes be as effective as topical steroids and has no risk of side effects. Here are some examples of some potential adverse effects of chronic topical steroid treatment. Keep in mind that these findings do not happen in 14 days. This is more likely to occur after 6 to 8 weeks of continuous steroid treatment. Atrophy of the skin, or thinning, is the most well-known side effect. This effect would be best seen in the top left and right images. Another common adverse effect is the creation of telangiectasia, which is the development of these prominent small blood vessels in places where they didn't exist before. Take, for example, the image in the middle. Here are probably the 3 most common reasons why therapy is not working. 1. The steroid you are prescribing is not strong enough. Many times, providers give too weak a steroid. Hence, this is why I'm advising to start with triamcinolone 0.1% ointment rather than hydrocortisone for anywhere but the face and genitals. 2. The patient is not using the medication. You'd be surprised how many people would rather Google search their concerns rather than feel silly asking them, and in their fear will not take the medications. Be sure that you educate your patients about how safe treatment is and answer all their questions so they adhere to treatment. 3. You have the wrong diagnosis. 2 other conditions that might mimic dermatitis, which is what topical steroids are used to treat, can include cellulitis, aka a bacterial infection of the skin, or a fungal infection. These latter 2 conditions require different medications to resolve. In closing, your go-to topical steroid for the treatment of dermatitis is triamcinolone 0.1% ointment, twice daily for 14 days. Keep this in your aid bag. Next, remember that there are other things that can look like dermatitis but will not get better with steroids, like cellulitis or fungal infections. So if the affected skin worsens or is not improving after a few days, reassess what is going on. Thanks for your time, and as always, run the line.